Thank you, Kristen. As we head into the colder months, local hospitals and pediatricians' offices are seeing an increase in RSV cases. And sadly, we're learning this virus has now claimed lives here in Western Mass.
Western Mass News reporter Paris Dunford joining us live in studio with more on how we can keep our children safe ahead of the Thanksgiving holiday. Paris.
Chris, Mary, Bay State health officials tell me this area has already seen 2 pediatric deaths from RSV. Their emergency department and pediatric ICU completely full of children suffering from the virus. Western Mass News has now learned 2 children in our area have died from the common respiratory virus RSV.
About 50,000 cases admitted to the hospital, about 5,000 children would die. And already Bay State Children's Hospital has had 2 deaths from very young infants, often with underlying medical conditions, die from RSV. So it can be quite serious.
RSV is a contagious airborne virus most dangerous to infants. Bay State Children's Hospital pediatrician-in-chief Dr. Charlotte Boney tells Western Mass News the pediatric ICU and emergency department have been full for weeks.
In September at Bay State Children's Hospital, we had the highest volumes in our hospital ever recorded. Last month in October, beat our volumes in September.
Local pediatrician Dr. John Kelly experiencing the same surge in his office. He says the reason behind the busier than normal season is the pandemic. Many kids weren't exposed to the virus last year as most were wearing masks.
There's like 2 groups of kids who really haven't seen a lot of RSV because of the pandemic and masking and separation. So we're just like twice as busy as normal.
RSV can be extremely dangerous and even deadly, as we've learned, but typically only for children with underlying conditions or those only a few months old or less.
You can't really avoid this virus. 100% of children get this before age 2.
Dr. Kelly gave Western Mass News some signs to look out for. RSV typically resembles a common cold, with a cough, fever, congestion, runny nose, and sneezing. And more severe cases can include fast breathing, flaring of the nostrils and head bobbing with breathing, rhythmic grunting during breathing, belly breathing, and wheezing. If you believe your child's symptoms are severe, call your pediatrician and they will help you decide if your child needs to go to the ER.
The vast majority of kids, 90+% of kids, if they get to us in time and we can give them supportive measures, particularly oxygen and other things until their body can basically clear the virus, will do quite well. They can get very sick very quickly, but they can also recover pretty quickly.
Now, as for the Thanksgiving holiday, Dr. Kelly suggests that anyone with even minor cold symptoms wear a mask and not hug or kiss small children or even elderly friends or family members. He also says good hand washing is a great defense against viruses like RSV. Reporting live in studio, Paris Dunford for Western Mass News.